adipose tissue. This adipose tissue is made up of fat cells or adipocytes. You also call them as adipocytes, or you can also call them as fat cells. This adipose tissue is distributed in the subcutaneous tissue. The fat cells they are present in the subcutaneous tissue, and this is called panniculus adiposus. So here you call it as panniculus adiposus, the fat that is present in the subcutaneous tissue. This panniculus adiposus is responsible for the smooth counter of the skin. If you see, underneath the skin we have got the subcutaneous tissue, and in this subcutaneous tissue there is fat present. This fat is responsible for the smooth counter of the skin. If you see the women, especially at the puberty or after the puberty, in case of women, we see lots of fat is being deposited in the subcutaneous tissue, which is responsible for the characteristic S-shaped curvature, which you see in females. This is because of the fat that is getting deposited under the hormones estrogen and progesterone, okay, after the puberty. If you see this fat or this adipose tissue, where all is it present? It is present in orbits, okay, in axilla, also in the ischorectal fossa. In the ischorectal fossa, you are having the adipose tissue being present. Also, the adipose tissue is present in the abdomen, especially if you see the kidney. Around the kidney there is fat present, and that fat is called perinephric fat. The fat which is forming a cushion, or it is forming a seat or cushion where on which the kidney is located. So that is what you call it as perinephric fat. This fat is very important because, please understand, these days we are going for some dietings, especially to get that zero size. People are doing a lot of dieting, and if severely when somebody is doing dieting or in crash course, in 10 days I will lose 10 kgs. If somebody is thinking like that and they lose 10 days, within 10 days they are losing 10 kgs. What will happen? This fat which is present, that is the perinephric fat which is forming a cushion for the kidney, will melt, and once this is melting away, then the kidney starts moving, and that is called floating kidney. This is what you are going to call as the floating kidney. So what happens because of the floating kidney? The ureter will show a kink. Okay, because of the kink of the ureter, now the urine will not trickle down into the urinary bladder. So whenever we are trying to lose the weight, yes, losing weight is good, but it should be gradual. How much? Maybe 2 or 3 kgs or maximum 4 kgs in a month, but not 10 kgs in 1 month or 10 kgs in just 15 days. That's not correct. Crash course dieting is not correct. Okay? And also you see fat, it is present in so many regions. The fat is also coming to the regions where fat is absent. Now we have learned so many sites where fat is present. Now we will talk about those regions where fat is absent. Where fat is absent? Any guesses? Yeah. So fat is absent in eyelid, okay, in penis, the male copulatory organ, and scrotum, the scrotal sac where the testis is being lodged, and also you got eyelid, penis, scrotum. These are the regions where there is no fat. Any other additions you want to make? Those regions where fat is absent? Auricle. In the auricle again, the fat is absent. So these are the regions where fat is absent. Now where else you think fat is present? Okay, we have covered a good amount of regions where fat is present. Now some more regions where fat is present. Fat is also present in greater omentum. In greater omentum, fat is present, and also fat is present in appendices epiploicae. Now, what are these appendices epiploicae? Appendices epiploicae. These appendices epiploicae. Now, what are these? These are nothing but peritoneal bags filled with fat seen attached to the large intestine, especially your transverse colon and the sigmoid colon. Here, attached to these, we have got the peritoneal bags filled with fat. These are called the appendices epiploicae. Now, quickly, let us revise where the fat is being present in the body and the regions where fat is absent. So, where fat is present? The fat is present in the subcutaneous tissue extensively throughout the body, and this subcutaneous fat is called panniculus adiposus, which is responsible for the smooth counter of the skin. Also, fat is present in the orbits, axilla and ischiorectal fossa on either side of the anus. Coming to the perinephric fat, so for the kidney, which is present on the posterior abdominal wall, both the right and left kidneys, they are present over perinephric fat, which is forming a cushion or seat for kidney to lie upon it. So this perinephric fat is lost if the person is doing crash course dieting. So if you want to lose weight, yes, you take minimum 4 to 5 kgs in a month you can lose, but not 10 kgs in 10 days or 15 days. Such crash course dieting can cause floating kidney, where the ureter is now kinked and the flow of urine is being stopped. So urine will be present in the kidney only, it won't go down into the urinary bladder. Then he has to be admitted in the hospital and the doctors must intervene, especially the surgeons. Okay. Then the fat is also stored in greater omentum, and the fat especially seen in the large intestine, that is the transverse colon and the sigmoid colon, is called appendices epiploicae, which are nothing but the peritoneal bags of fat. Okay, and now those areas where fat is absent, you don't have fat at all in these regions. What are they? In the region of eyelid, penis, scrotum and the auricle. In these areas, there is no fat present at all. Thank you. Let us now discuss about the types of adipose tissue. How many types we are having? We have two types. One, which is called the brown adipose tissue, and other one, it is called the white adipose tissue. So one is brown adipose tissue, other one is a white adipose tissue. This brown adipose tissue is also called as multilocular adipose tissue. Okay, and the white adipose tissue is also called as unilocular adipose tissue. And some people, they would like to call the white adipose tissue also as yellow adipose tissue. And this brown adipose tissue is also called as an embryonic type of adipose tissue, and this is also called the white adipose tissue is also called as adult type of adipose tissue. Okay, now let us learn them in great depth. If you look at this brown or multilocular adipose tissue, now here we are having a fat cell, right? In this cell we have got nucleus. The nucleus is rounded but not in the center, okay? Round or oval, whatever you say. Then surrounding it you have got lots of fat droplets. Because lots of fat droplets are present, you call it as multilocular. And we have got the cytoplasm that is present in the cell. Okay, the cytoplasm is having mitochondria in abundance. Lots of mitochondria are present. Endoplasmic reticulum are also present. The mitochondria which is present here in this brown cell, it is rich in cytochrome oxidase. Cytochrome oxidase is present in appreciable or a good quantity in the mitochondria. This is imparting the brown color to the fat. So we are calling this brown fat because it is appearing little brownish in color. This is because of the cytochrome oxidase that is present in the fat cell. Also, the mitochondria, they are having one protein called thermogenin. What is this protein? Thermogenin. So this protein is producing the temperature. This fat, the brown fat, is acting like heat generator. It is going to generate the heat. This is because of the protein thermogenin that is present within the mitochondria. In whom you think this brown fat is present? It is seen, one more name, embryonic. So that is seen in the newborn babies. Okay, here we are having lot of the brown fat. The baby, it is suckling its mother's milk. How is it able to suckle? There are no teeth in the mouth of a newborn baby. But if you see the cheeks there, when you try to palpate, when you are touching the cheeks of the child, you find they are little, firm. And this is because of the suctorial pad of fat that is present. Suctorial pad of fat which is enabling the baby to suckle the mother's milk. It is a brown fat. In adults also brown fat is present. Where? It is present in the posterior abdominal wall. In the posterior abdominal wall. Or again the posterior triangle of the neck. In the posterior triangle of the neck, there is some brown fat that is present. This brown fat, as the child is growing up, it transforms itself into the white or yellow fat or the unilocular type, where these small fat droplets, they unite together and they form one single large molecule. For example, now this is a cell. Here the nucleus is now flattened, pushed to the periphery, as you can appreciate, and here there is single large fat dropule, that is single large fat droplet, what you are seeing, and here you have got the thin rim of cytoplasm. Here you are having the thin rim of cytoplasm. So here you see the flattened nucleus pushed to the periphery, right? Here you have got cytoplasm which is a thin rim and one single large fat droplet, so you call unilocular. Are you able to appreciate? Here you see these are all small fat droplets, many in number, but here they are united to become one and have pushed the nucleus to one side. Now where do you get this unilocular or white or yellow adipose tissue of adult type? You get this in the orbit, okay, which is present around the eyeball, in the ischorectal fossa, that is on either side of the anus and the anal orifice. Also we get such type of fat in the peritoneal folds, in the greater omentum, okay. In all these regions we are getting the white or yellow type of fat that is present. So this you are getting in the orbits, in the axilla, in the ischorectal fossa, in the peritoneal folds. Now please understand, the fat cells, they are extremely vascular, they don't have mitosis. They are extremely vascular, they don't have mitosis, they produce a hormone called leptin. There is a hormone called leptin which is produced by the fat cell. This production of leptin hormone is under the control of a gene called with the same name, leptin gene. If there is any defect in the leptin gene, or if there is some deficiency or some problem with this leptin hormone or the leptin gene, then the person is becoming obese. So now if you want to treat obesity, so maybe we have to take the help of gene therapy. The horizon is opening up for the gene therapy. The horizon is opening up for the gene therapy. Are you understanding? Because the fat cells, they produce a hormone called leptin, which is under the control of a gene called leptin gene. So this leptin gene, if there is a defect or if there is any deficiency in this leptin gene, that will result in obesity. And by gene therapy, you can correct it. I hope you have understood something about the broad tissue and the white adipose tissue, the two different types of adipose tissue. Thank you very much.